let's talk about the symptoms because when you were in the shower and
Hmm.
you, I never did a self breast check, so
Yeah.
I never even. It's interesting, like that you would feel that, and
Yeah.
that at least you had the background of that video, and
Hmm.
understanding that this breast cancer. Help me if I'm correct in this, that it does not show up at all as a lump or a
No,
bump. Is that
it can be a lump, but that's even more rare to have it show up as a lump. They describe it as like a spider web type cancer, or
in the
more of a
blood?
yeah, or more of like a plastic type cancer that can spread easily through your body. And what it does is it attacks the dermal lymphatic system under your skin. So once it gets into that system, I mean, it can just travel.
Wow.
Think about when you get a shot or something, that's going into the dermal lymphatic system. That's how that travels through your body. So that's where this IBC goes, and it's like a subway system through your entire body.
Yeah.
Um, yeah, it's scary, and it's like I said, it's very aggressive. They did an ultrasound on my um, axillary lymph nodes in my underarm, and they said everything looked fine there. Of course, they couldn't 100% say that they didn't have cancer in them at the time, but they weren't swollen. Everything looked fine on that ultrasound. Now, when I had another scan 3 weeks after that, they had counted that it was on the PET scan that it was in 8 lymph nodes. So it was all through here, within 3 weeks. So yeah, it was really, really cooking. And even my oncologist office said when they got the results from the lab, they had put a note on the lab results saying that this cancer is wild. That's how they described it, you know. So I mean, they were watching it. They were from the lab on, however they look at it under a microscope or whatever. But to say your cancer is wild, I mean, they were really concerned, and I was saying we want to plan a trip really quick to go away before I start treatment so that my daughter can have a good time because it's going to be a while before things are back to normal. And they said, if you're going on a trip, you're going this weekend because we are starting your chemo on Monday. I mean, and it was like, if you're going to do something, you've got to go now. You're not waiting any longer. So
I
yeah.
think, let me ask you a question. If you were in the shower and you felt this and you blew it off, did you talk
Yeah.
to did you talk to them about that? This is why it's so important what you're doing, because if women
Yeah.
see anything similar to what you're talking about,
Yeah. I haven't talked to them about that, but I have thought about that for sure. Like, what I don't know where I would be if I had waited. And I would have. If honestly, if I didn't have that mammogram scheduled
you would have blown
already,
it.
I mean, I was due for that yearly mammogram. So I probably would have waited until I really started seeing a lot more severe physical changes. Because at the time when I went in for the mammogram, my breast tissue was just hardened and my breast was slightly pink.
So you were like,
So,
whatever, no
yeah,
big deal.
but it hurt. There was definitely soreness and tenderness there. I keep touching that same spot as I'm talking
Yeah.
to you. But
Yeah.
yeah, I always tell women now and men, tell everybody when you're doing your self breast exam, whether you do it in the shower or laying down or whatever, also add to that looking at yourself. Look at yourself in the mirror and see if you notice a physical change. Really get to know your body, know how your clothes fit, how your bra fits. My bra didn't fit on that side anymore, so it was obviously changing and something was going on. A lot of times people think they have mastitis, and the doctors often will think that that's the case as well. And so, we're given an antibiotic and it's not doing anything. So, meanwhile, the cancer's just growing in there, rapidly.
Mm-mm-mm.
So, yeah, I encourage everyone, like I said, take a look at yourself, really get to know your body. If you see the slightest change, go to your doctor, and you have to speak up for yourself. You have to be an advocate for yourself. Um, and if you feel something in the pit of your stomach, if you just kind of feel like, I just know, really check that out. Listen to your body because nobody knows your body like you do.
Mhm. I mean, and also your age, I got diagnosed older. And so women in their 30s, 20s,
Mm.
40s, they're not, I mean, breast cancer is like the last thing I would imagine that was on your mind in your life that you're living. You're just living your life.
Right.
And what I really want to stress on is the hardness of the
Hmm.
skin. You're making me want to touch because I
Yeah.
was walking around with a walnut-sized tumor here, can't see
Right.
me. And I never did self breast exam. So here I am. I had something that I could actually feel and touch and
Hmm.
never did. And
Right.
so if just went in the shower and you're feeling this hardness of the skin, did the doctor explain to you why is the skin getting hard? Is the blood just, forming together? Do we know this?
Yeah. No, the doctor didn't say anything about that. The
Okay.
doctor, was my gynecologist, and that's where the mammogram is, where I would get my mammograms done at her office. And
Okay.
so when she looked at me, she said, "Yeah, I mean, there's definitely some hardness going on in here. It might be an infection. I don't think it's anything to worry about, but I would like for you,
Okay.
the 3D mammogram and the ultrasound." So, I mean, I had those done, and when she actually called me personally and said, I wanted to check and see how you're doing. And this was several weeks later. And I said, I have cancer. She didn't even know yet. She was shocked. I said, did you see anything that you thought would make you think this is cancer? And she said, no, I didn't. See, and that to me is just a testament of how little,
Yes.
how few doctors actually know about inflammatory. And I'm
And
not putting the medical community at all by saying that, because it is so rare. It is one of those things that I think, like my radiologist, you just have to have an eye for something like that. But I think it definitely opened up her eyes.
mm,
I need to be more cautious about this when I see it in people because, she's an OBGYN. So a lot of times it is mastitis that women are in there with very similar symptoms, redness and soreness, and it can get much worse. I mean, thankfully mine never got to the point where I had, they call it peau d'orange or something like that. I don't know how to pronounce it correctly, but the skin of your breast will actually look like an orange peel. It gets so red and so thick, it starts, you see all this dimpling all around it. And mine never got that way. In fact, as soon as they started treatment, I had my first chemo and immunotherapy. I mean, within days, I could feel things softening up,
mm,
and even the doctors were just like, it's melting away, it's just melting away. And that is kind of one of, if there's anything cool about IBC, one of the cool things about it is you actually see the change happening, you know what I mean, because here I'm looking at my swollen, painful, thickened red breast, and
going
it's
away.
kind of back down to normal, right before my eyes.
You didn't
So
get a double mastectomy.
I had chemotherapy and chemotherapy first, and then I had my mastectomy on the left side. I then had radiation, and then I had reconstruction surgery, but I had the right side hollowed out. So all of the breast tissue was taken out of the other side. So technically, yes, it was a double mastectomy. But they filled it right back in with fat. I had a deep flap. Actually, I had a hybrid deep flap done, which is partial implants and partial fat. So
It's interesting. Haven't
yes,
heard
it
of
is.
this one yet. Yeah.
Yes.
Yeah.
So I had that done, and they tested the tissue from my right breast, and it did show atypical hyperplasia, which means it would have come back.
I had
I
that
mean,
too. Yeah.
so
Oh my.
they they said it made my risk of recurrence recurrence like way down, you know, by removing that tissue.